Hello, everybody. Welcome to the Very Connected podcast. And so happy to have all of you guys here. We are being joined today by the lovely Aimee Rothe, who is
Hey,
a
everybody.
nurse and such a good friend. Oh my gosh, Aimee has been with us several times. I just knew we had to have her back. She always has something good to say and share and has so much experience and so much knowledge. You guys are going to love this topic today as well. We're talking about weight loss plateaus, and the topic title is the plateau physiology, why this scale stalls, and how to respond without panic. And actually, Aimee and I was just talking right before this call. You get up in the morning and weigh, and like, how does that set your day off? She's going to be sharing some more evidence-based ways to kind of look at, perceive like your journey, and also how to kind of be more non-reactive and some strategies to move forward with that. And Aimee, I'm going to tell a little bit about your background, but then I'm going to let you jump in because I know that you are able to share a lot more deeply about what you do and the community that you serve personally. So, Aimee, Aimee serves as the program director of metabolic and bariatric surgery at a hospital system in Alabama. And we were just talking, she's in the middle of getting all of their accreditation stuff ready for their Center of Excellence accreditation. She also helps lead their Blue Cross Blue Shield Blue Distinction surveys. And her journey began with a lap band in 2010, followed by a revision to a vertical sleeve in 2017. And she understands firsthand the journey that many people are going through that probably likely are on this call, because these calls are generally for people who are on a metabolic weight loss journey. And basically, Aimee, I feel like a lot of your passion is surrounding helping other people through your own journey. And I'm going to kind of let you talk a little bit more about that.
Let me share my PowerPoint real quick. 'Cause
Yeah. And guys, if you're joining us on the live event, please let us know where you're from. I see a few people saying hello. Hello, Rhonda and Susan. Let us know where you're from, a little bit about yourselves, so that you can connect here in community and um, go from there. So Aimee is getting ready to share her screen. I'm also going to connect onto Facebook. We're live streaming there as well. So if you're on Facebook, please let us know a little bit about yourselves as well there.
All right, I think I got it working. All right. Good afternoon, everybody. It's 1 o'clock here in Birmingham, Alabama. Um, I am Aimee Rothe, and I met Brenda years and years ago through ASMBS. I am a program director here. It's Letha. Hey, Letha. I'm a program director here in Birmingham at a large hospital system. The program that I am currently overseeing has been around a very long time, since around '07, '08, and has been accredited. I have been a nurse almost 20, well, actually 20 years, and the past six have been in bariatrics, metabolic and bariatric surgery. I worked in emergency medicine for a majority of my career. And what kind of led me to bariatrics was a shift in my own journey. I spent long as I can remember, honestly, from childhood, struggling with my own journey of obesity. I was well over 200 pounds when I graduated high school, struggled with polycystic ovarian syndrome, Hashimoto's thyroiditis, and had a lap band in 2010. Was, I would say, not amazingly successful with that, had some complications, ended up revising to a vertical sleeve gastrectomy in 2017, and have kind of been on this journey since, which has involved skin removal, and that's how I ended up in bariatrics. I like to say that I love this job. I love walking other people through this journey because it is one of the, I like to say, the craziest journeys I think that we go on as humans, is this journey after bariatric surgery. And that leads me to what Brenda and I were kind of going to talk about today. I think that years of just feeling that sense of impending doom is what I call it. You automatically assume things are going to go wrong. I have tried this, I have tried that, I have tried everything in the world to fight this disease of obesity, and I've always had issues. And so when you hit that first plateau after surgery, we automatically go, "Oh my gosh, it's happening again. Oh my gosh." And we set off this huge panic. And I see it often in my patients where they will it'll ruin their entire day. They'll just automatically jump to this horrible place mentally when that scale stalls, and they'll automatically start labeling themselves as a failure, or they'll start questioning, is my procedure working? What did I do? So I want to talk today a little bit about what is a plateau? What is a stall? What actually constitutes those things? But also, how do we respond to those without looking like the person on the screen, without that panic? Oh my gosh. I was just telling Brenda, I went to the doctor the other day and I wear these big heavy nursing shoes and they wanted me to get on the scale with my shoes on. And I was like, no, that's not happening. And then I thought to myself, what am I doing? I know the shoes weigh 5 pounds. How is that going to ruin my day? But it would have. So let's dig in. Little bit of kind of background. I am so very familiar with stalls and plateaus. So very familiar. Um, my own journey started at 415 pounds. When I had my sleeve, I was right around 350. Since then, I've had a child. It's almost been 10 years. Today, I am resting at around 182 pounds. I do take a GLP-1 for maintenance because it has done amazing things with my polycystic ovarian syndrome. And I am very proud of my use of GLP-1s and their continuance after bariatric surgery. But if you ask me so I map my weight once a week on this app on my phone. And if you ask me what it looks like, this is what I'll tell you it looks like. That's exactly what it looks like. It is up, down, sideways, backwards, forwards, and just a huge conglomeration of numbers that go up and down. And I tell my patients this journey is not linear. And I think that this icon really describes it. Your journey is not linear. It was never meant to be linear. We are meant to have plateaus. We are meant to have reoccurrence. We are meant to have loss. That is how the chronic disease of obesity works. So if your weight loss pattern looks like this, you have not done anything wrong. You are simply a human. So we're going to talk about what a plateau is. We're going to talk about actually looking beyond the scale at other things that we can use to see if we're actually changing, if our body morphology is actually changing. We're going to talk about why the scale stalls, some adjustments that we can make, and then we're going to actually talk about when. When do we need to say, okay, I've got something going on and I do need to seek support. So the clinical definition, okay, the clinical definition of a plateau is a stall on the scale of 4 weeks or more, okay, despite staying consistent with everything that you were doing, okay? So for it to be called a stall, you can't have recently made any changes for better or worse, okay? And it has to be for 4 weeks or more with no change. That also cannot include any change in your measurements, okay? Because people will say, okay, I'm stalling, I've hit a plateau, but at the same time, my clothes are fitting differently. Well, then that's not a stall. That is your body redistributing that tissue, okay? A few flat days where that scale does not move, that's normal noise. Like that is completely normal. We also, I think, have to have that realization that a true plateau is expected. Okay, it's going to happen. And most patients hit that first one, sometimes even earlier than month 6, which I don't really call it plateaus during that kind of labile period of early loss. But most patients will hit that one good plateau between month 6 and 12 that will, for lack of better words, scare the bejesus out of them, to use a Southern term. Okay, because I'm very Southern and I use Southern terms. Okay. Now, what plateau is not? plateau is not a failure. It is not a sign that you have broken something, that your surgery is not working. And it is also not a reason to panic and drastically restrict your food intake down to almost nothing. Okay. I know that we all carry a lot of baggage. And truly, a lot of us have experienced healthcare bias where maybe you've gone to a provider and they've said, well, if you'd eat less, you'd lose weight. The problem with that is when we hit that plateau, that our mind flips back to that. I need to restrict. I need to eat less. And that is not necessarily going to fix the problem. Okay. So just remember 4 weeks is that threshold. Okay. 4 weeks is that threshold that separates that day-to-day fluctuations, which are human, from a genuine plateau that you need to take action for. So why? Why does this scale do all this crazy stuff? Okay. You do have to remember that the scale is a big picture of everything. Okay. The scale is a number. It is a picture of not just the adipose tissue we carry, it's a picture of our tendons, our cartilage, our bones, our non-tangible muscle mass, how much fluid you drank that day, how long it's been since you went to the bathroom. There's all sorts of things that make that number happen. As you lose weight, you have to remember that disease of obesity, it's fierce. So your body's like, I don't know what this lady is doing, but I am actively going to protect these energy stores. Okay. So it's working to actively protect these energy stores. And this is what happens. You have a little bit of metabolic adaptation. Okay. A smaller body burns fewer calories doing everyday activity, right? So if I weigh 200 pounds, I have surgery and I lose 50. So I weigh 150 pounds. That 150-pound body has it burns less calories just walking from point A to point B than my body did at 200 pounds. So your metabolism also becomes more efficient and that meal stretches further. So number one, metabolic adaptation. Your body is going to work towards doing what it thinks it should do at that point. The second thing is you can have that weight holding while still having fat loss. You could be gaining lean tissue, which is actually not a bad thing. It's what we want. We want a good solid lean muscle mass, but you can be gaining lean tissue while losing fat, especially if you have added strength training, exercise into your diet. You can have that preserved muscle and shifting composition, which means that scale may not actually have that drastic change, but your body will be changing. Fluid and hormonal shifts, water retention. We retain water throughout the day, especially if you're doing what you're supposed to do and you're drinking your water all day long. We have sodium retention. We have hormones, ladies. We have even healing. You think, okay, I had surgery 6 months ago and I should be healed by now. No, absolutely not. Your body is going to take time to adapt and heal. And so that can really mask that loss for days or weeks after that surgical procedure. You also have a little bit of a set point defense going on. So you have the ghrelin and you have the leptin hormone production that is affected by the surgery, and those fullness hormones, the leptin, they adjust. They want to adjust. Your body kind of knows what it needs to do to keep itself alive. So they adjust to nudge that intake back up. And it's biology. So if you're like, oh, I'm 6 months out, I'm starting to feel hungry again. Wait, thought they told me I'd never be hungry again. This is crazy. No, just understand that we were never meant to never be hungry again. Your body is going to adjust and nudge you. Okay. So all that's going on, the scale's not moving like you think it should. And you go, oh my gosh, I don't know what to do. Okay. I want you to think about it this way. Think about building the plateau into the curve. Okay. So here's my weight loss curve. The stall is built in. Look, there it is right there. Okay. Got that rapid early loss. Everything's going great. And then I plateau out for a little while. And then I have a little bit more of a gradual loss. I would say that pause is kind of the shape of the process. Okay. So that early fast loss that we experience right after surgery, yes, it is adipose tissue, but it is also a lot of fluid and other things like that. And that flattening means that your body is working on finding a new balance. So it's not necessarily a negative thing. Your body is finding a new balance in this journey. And that loss is oftentimes once you resume and kind of tinker with one variable, a lot of times that scale starts to move again. So here's what we have going on. Okay. The scale weighs everything, unless you have one of those fancy Renfro scales, which I highly recommend because they break this down into terms that sometimes will help you understand. But after bariatric surgery, only about a third is fat tissue. Okay. And all of these things are adjusting and changing from day to day. So, as far as your body, it's made up of about 50% fluid. And you shift every day. Whereas sodium comes in, fluid follows. Okay. Whereas you have hormones, you have stress. Brenda and I were just talking about it is hot here in Alabama. Okay. When it is hot, your body retains more fluid. And a lot of times that's the biggest source of that daily movement and noise are just normal fluid shifts from a day to day basis. About 30% is going to be that adipose tissue. Obviously, it is higher before surgery than someone whose BMI is 18.5 to 20. And it is also the slowest part to change on the scale. About 15% is muscle. Okay. We have muscle. We have countless muscles in our body, ranging from giant ones like your gluteus and your quads, all the way down to tiny itty bitty extensor muscles. And sometimes after surgery, your body will try to sacrifice that muscle. If you're losing weight quickly, anytime a human is losing weight quickly, especially if we're not getting our protein in, your body will want to sacrifice that lean muscle mass instead. So we want to protect it. We want to build it back up. We want to add in strength training and things like that. But as we're doing those things and we're building it, it can hold that scale steady at that number as the amount of adipose tissue drops. Now you got some things we can't do anything about, right? We have bones. We have a whole bunch of them. And they're in there and they're hanging out and they're staying stable. We have organs. Okay. Organs aren't going anywhere. We can take them out one at a time, but it really doesn't help the scale. And then we have waste. Okay. So you've got waste in transit. You've got urine production. You've got stool. If you're not getting a lot of fiber in your diet, you could have more stool, which is going to be its weight. It's an increase in the scale. And that can swing that number a good 2 to 5 pounds a day just with the waste production from our body. So what I would like us to do today is really think about how do I shift the way that I see my journey? Like when I call myself successful on this journey, how do I shift it from allowing that one number on that scale to rule my entire viewing of myself? How do I shift it to looking beyond? Okay. Scale measures one thing, and honestly, it measures it badly. Okay. So let's think about the non-scale victories. While that scale is not moving, do your clothes feel different? Okay. Do they feel different? Does your waistband feel different? Do your jeans feel different on your thighs? Do the bands of your shirts feel different on your arms? Are you having to go down sizes in clothes? Because even if the scale is not moving, if that's happening, that is still success. I always encourage patients get a set of measurements prior to surgery and block out those measurements. Not every week, but about once or twice a month. Get a repeat set of measurements, log them so that you can look at that body composition change directly. There are even places that will do caliper assessments of fat tissue, DEXA scans that will do body what they dunk in the water, the erythropoiesis measurement, where they measure the amount of muscle, which is more dense than fat. So there are all these other ways that we can get our measurement.
Hey,
Measure,
Aimee.
uh-huh.
Nina's asking about the Renfro
Mhm.
scale app. She
Mhm.
says she also has seen new ones where people can
Mhm.
hold a handle for body scan. And she's asking if you know anything about those or if you can.
The ones where you hold the little silver thing, that is going to measure body composition. That's going to measure it kind of measures your muscle, your body composition. It does a little bit more than just measure the scale. It's going to measure your muscle mass, sometimes your fluid, the amount of fluid, things like that. And those are nice to have because that gives you a little bit of a deeper view into what's going on, other than just hopping up on the scale and seeing a number. Let me ask this, you guys. How many people have had that moment after surgery where you go, oh, wow, I walked up the stairs today and I did not get out of breath? Oh, wow, I tied my shoes today and did not almost pass out. Has anybody had that moment? Oh, wow, I got on the floor to wrap Christmas presents and actually got back up. That was mine. Um, I want you to look at that too. Those daily tasks, those daily things that I think most people take for granted are absolutely ways that we can measure success, because that's why we do this. We do this to be active participants in our lives. We have surgery so that we can become active participants in our lives, and that's the kind of things that I want you to look at other than the scale. Obviously, if you had diabetes before surgery, if you have high blood pressure, if you have hyperlipidemia, sleep apnea, all of the comorbidities that kind of go along with obesity, look at those health markers. There is nothing honestly better with celebrating my patients. And I know this is such a geeky nurse thing, but to watch someone's total cholesterol go down and their HDL go up on their labs and trending, and you're like, look, this is proof right here on a piece of paper, right here in front of you, that you are making changes. Your A1C has changed, your triglycerides have changed, your HDL and LDL have changed. So look at those health markers and use those as kind of a looking beyond the scale. Okay, wow, there are things changing. Sleep and mobility. Are you getting good sleep now, whereas you weren't before? Better sleep, less joint pain, easier movement. All of those count. And to me, I'm a huge proponent of how this journey affects our mental health. And so you want to think about things like, how do I feel about myself? Even though the scale may be not moving like I want it to, have I had improvements in being consistent? Have I had improvements in habits? And how do I feel about myself? Those are definitely victories worth tracking. And I think that all of these things together mean so much more than that number on the scale that may or may not move from day to day. So instead of, okay, let's just say this. We can all have our moment, right? Let's all have our moment of, okay, we've all done it. Oh my gosh, panic, freak out. Do it for a second, just a second, and then take a deep breath and go, wait a minute. Okay, let's take a step back. If you have a situation where you have that stall greater than 4 weeks, let's adjust one thing at a time. The worst thing that you can do is change everything about everything you were doing. Then you kind of don't know what that factor was. Okay. So change one thing at a time, give it 2 to 3 weeks, and reassess. Okay. Do not panic and make these huge drastic changes. And so these are probably the top 6 that I see. Okay. Actually look at what you're taking in. Okay. Look at your portions. There is nothing that will keep you honest more than writing down what you take in. And I think that, and I've never really seen a food journal as punitive or failure, but you got to log the good, the bad, and the ugly. Is what I tell. And I do, like, I eat a Reese cup? Absolutely. Do I write it down? Absolutely. Because just because I didn't write it down does not mean I didn't eat it. So really look at your intake for a good solid week. Write it down and see if there's been anything that has changed recently. Maybe there's an increase in grazing. Maybe you're skipping meals at this point. You're going all day without eating. Is there anything that is nutrition related that you could work on? And always, working on those protein goals, working on getting your good complex carbohydrates in. Second, if you are not doing any sort of resistance training, it's probably a good time to add that in. Okay. Building muscle is going to raise that calorie burn, and it's also going to reshape your body even when the scale's not moving. it's going to reshape that body composition. Anybody here you've been told that sleep has a correlation with weight, and you're like, oh, here we go. Here goes this lady telling me that if I would sleep, I would lose weight. I think that 5 or 6 doctors told me that as I was on my journey. There is some truth to that. If you are stressed out all the time, right? Okay, you stay in a level of just panic all the time. Your cortisol levels are not going to quite be right. Your cortisol levels are activated. It's your hypothalamic system, it's a whole thing. But it activates your cortisol levels, puts you in fight and flight, and your body goes, oh my gosh, I don't know what she's got going on, but we got to fuel for it. Hold the water, hold the water, hold the water. Make her hungry, make her eat. We got to fuel for it. And then you're just kind of in that constant state. So we do have to protect ourselves, protect our sleep, and protect our stress levels on this journey too. And I do know that that's easier said than done, but there definitely is a physiological component to that. Hydration. You didn't think you were going to get out of this sport group without talking about hydration. Water supports your metabolism. Fluid supports your metabolism. And sometimes, if your body's retaining fluid, that's its way of begging you to give it something. Okay. It's begging you to give it some fluid. So it's going to retain it, and you're going to have that false stall. So track your daily fluid intake. Make sure that you are meeting those goals there. Fluid does so much for our body, not just, it does so much more than just weight loss, so much more of the overall wellness of our body. We talked about logging honestly for 1 week. And then be patient. Okay. Give it some time. Be patient. The body does not respond immediately. It does need a little bit to catch up and to respond. So resist that urge that I know we all go to where we want to slash those calories dramatically, go back into those disordered eating patterns that we have experienced. That at this point is not going to be beneficial to you. It will actually contribute to that stall. And so at that point, if you have made those small adjustments and you're still not seeing any changes, then it's time to cycle in with your team. And I think that we as patients, our first urge is to do the opposite right here. When we stall, when maybe the scale's not moving like we want it to, sometimes we say, oh, I don't want to go back to my doctor because the scale's not moving, and oh, he's going to be so disappointed in me. And then all those feelings of I'm not good enough type situation happens, right? You know, a lot of patients that I call it ghosting. Please don't ghost your bariatric team, by the way, but a lot of patients that ghost us when they finally, when you go, hey, what's up? What's going on? They'll tell you, I stopped losing weight and I didn't want to come back because it was embarrassing. I stopped losing weight. I didn't want to come back because I thought that you would think badly of me. I thought that you would judge me. And that is exactly the opposite. That is why we are here. We are here to support you. So the time to come back is when you are having this issue. So we're going to reach out. If that stall lasts more than 8 to 12 weeks, despite consistent effort. If you start to notice unexplained weight regain, there could be something else going on. Vitamin deficiencies can cause some issues. Hormonal shifts, menopause, can't do anything about menopause, but it's coming for some of us. Um, Thyroid issues. I had a patient a couple of weeks ago who I have a program here called Recharge, and she had surgery several years ago, and it was just like, I don't understand what's going on. I've had some weight reoccurrence, but I've been doing everything. And I was looking at her medicine list, and I said, how long have you been on this dose of thyroid medicine? And she's like, probably 6 years. And I said, and when's the last time you had your thyroid checked? And she's like, probably 6 years. Guess what? She went to the doctor. Thyroid was crazy off, got the meds adjusted, saw movement on the scale. So you got to think about things like that too. You got to look into the whole kind of situation. If you have new symptoms appear along with that plateau, so are you really tired? Is this just not something's not feeling normal? Your hair is changing, you're dizzy, you're nauseous, something else is going on there. If you are not taking your vitamins, I realize that that is such a minute thing to hear is, you should take your vitamins. And out of all the other things that we're struggling with, I'm asking you to log food. I'm asking you to give yourself grace, but I am also wanting you to understand the importance of those vitamins. They are very important for us as post-ops. They are very important for people in general. So if you suspect something's going on, I've got a nutrient deficiency, I'm definitely not taking my vitamins like I'm supposed to. Maybe I need advice as to what I should be taking. And really important, if that plateau has got you so messed up that it is affecting your mood, motivation, and the way that you feel about yourself. If that plateau comes, slaps you in the face, and knocks you down to a really, really low area with mental health, it is time to seek support. And we all know that that does happen. And so as far as your team, different places have different levels. I know here we have obviously me, program director. I have a dietitian. We have mental health resources. Every program usually has a support group, or you can dial into there's national support groups like ProCare. So there are ways to kind of get that team rallied around you, but just don't ever feel like you can't circle back. That's why we're here. We're not here just to operate on you and leave. We're here to be your support system for the rest of your life after this surgery. So if you take one thing from what I talk about today, I want you to understand this is the scale is paused and you are not. That's why I tell my patients. The scale is paused, but you are not. A plateau is your body proving to you that it can hold a new, healthier balance. And there's three things that you have to do. You have to expect it. It's normal. It's predictable. It's going to happen. Track your non-scale victories. Track the other ways of establishing my composition other than the scale. And then if it does happen, adjust calmly, one thing at a time, and try to avoid that initial panic that I think that we all feel. So I love this picture. Actually, this is in my patient guidebook that I give my patients. And this is probably the best quote that I have ever in my life seen that describes a journey after bariatric surgery. It says, progress is not linear. It's an old quote. And you can kind of see the person going up the mountain. This is what the journey after bariatric surgery looks like. There are highs and there are lows, and there is everything in between. And it's probably the most amazing journey I've ever been on, but it's probably one of the hardest. And I'm sure that many of you out there can definitely agree with this picture. Does anyone else have any questions? Anybody want to share their stories about plateaus? I'll open it up to some discussion. We got comments in the chat box. Let's see. Someone has a scrub jacket hanging on the back of their chair that was their non-scale victory. I I feel that as a nurse. I still have my size 4 extra large scrub pants. That's the one thing that I kept. And I wore them babies until they fell off in the ER one day. The string come untied, and that's the day that my coworkers made me get new breeches. Is the pants fell off.
Mm.
Let's see. I said, say it louder, think that. Take the vitamins. Other people are going through menopause like me too. Ooh, this has not been a fun journey. Let's see. A lot of things about vitamins. Y'all, I need to give a shout out. Can I give a shout out?
Yes.
Lisa Griffin is on this call. Lisa Griffin was the bariatric coordinator when I had my sleeve revision. And that's a very full circle moment. And it's kind of crazy. And thank you, Lisa, for helping me on my journey. It's kind of weird. It's kind of cool.
Lee, I have to say, Lisa, too, thank you for joining us all these times. She's here with us quite a bit. And she's talking about the vitamins too, thinking about it as your new medication. You should never miss a day or face the consequences.
And
I still remind myself all the time. I actually put out some jars today on my table, like just to remember, especially the calcium, because it's like spacing it out during the day, just having it someplace where I can see it. So,
I have I have vitamins everywhere. I have vitamins in my purse. I have vitamins on my desk. I have vitamins at home. I have vitamins everywhere. I have tried, I think my low point, I bought this vitamin Keurig one time. It is a little disc of vitamins and it grinds them up and it mixes them with some water and makes this absolutely horrific vitamin paste. But I thought that was going to make me take my vitamins. It did not, by the way. Yeah, it did not. I think that Rhonda says she sets her phone. Yep. I do think that somebody mentioned that vitamins are a new medicine. And that's kind of how I look at it. We trade things like your metformin, your low pressure, your blood pressure medicine, your cholesterol medicine, all of these things that some of us had to take prior to surgery to manage those comorbid conditions, right? And you really don't want to take those anymore. You want to get to the point where you come off those after surgery because it's a hassle to take medicine. We all know that. I'm a nurse and I'll tell you it's a hassle. And so we want our goal is to get off medicine. And then here's someone telling you to take vitamins. I look at it this way. I am replacing those medications with my vitamins. And it's a trade off that we have to take after surgery to come off of some of those medications that do have side effects, right? We don't want to feel bad. We don't want to get the body aches from our atorvastatin. We don't want to get GI issues from our metformin. And so think of it that way. They're prescriptions. I know we get them over the counter, but they're prescriptions. And I think that we should think of them that way.
Amy, there's a couple people that have commented on Facebook. One of them is saying that um, Kathleen saying, I haven't seen my nutritionist for 3 months now. I faithfully take my vitamins. I'm guessing that maybe she normally sees her nutritionist on a scheduled basis. I guess some programs have patients
Mhm,
seeing their
mhm,
their person periodically. And then
mhm,
Pamela says, I take my vitamins. The only one I can't take is calcium citrate. I don't
mhm,
feel good after I take it. I'm wondering
mhm,
with that, I'm almost wondering if maybe trying different forms, like different companies,
mhm.
or the other thing I would suggest is trying to get in more calcium in your diet too, if you are having struggling with supplementation. So,
If they're causing GI upset, look at the
mhm.
time of day that you take them. I went through a period where I actually had to take my calcium at night because it caused a little GI upset. I will tell you guys this, and it's not because I'm here with ProCare, I promise.
Mhm.
They have this powdered calcium, right? It's and you can mix it with your drinks. It's looks like Crystal Light packets, but it's calcium. And I have found that I've had a lot of patients who just struggled either with the texture of calcium or it just causing GI upset, right? You put things on your stomach and it just doesn't agree with you. Um, it seems to work well mixing that calcium in. Now, of course, don't mess with calcium and iron, don't mix them together, but you might want to try the ProCare sticks. I have had a lot of success with patients doing well with those, mixing them in their morning coffee or something like that.
Thanks, Amy. I can show here in a little bit. I
Mhm.
can show how to find that on the website so that they can access that. And Nina, thank you. Nina is also saying ProCare is
Mhm.
affordable and has been taking for 3 years. Easy to take. Love the calcium chews. And our calciums are actually made of something called True Cal, which is filtered down milk with the lactose removed. So it's generally pretty good on the stomach. So if you're struggling, we do give away free samples. I'll show people how to get samples to see, maybe try some different things and see if it works for you. So um
Is it almost time for the chocolate calcium to come back?
yes, it's getting closer. Usually like September, October. As soon as the temperatures turn colder, so it won't melt, but it should be it shouldn't be long at all.
I have to
And
not keep that one at home.
I like dipping that one in peanut butter. Our chocolate calcium.
Mhm,
Oh,
mhm.
I use it with peanut butter. I don't know why I love that. And Lisa has a good idea. She says, I use what I call a granny box got it at Walgreens. It has 4 compartments that I fill
Mhm.
up once a month. If I go home today and a Tuesday box is still closed, I know to take my vitamins. I agree because I sometimes forget whether I've taken my supplements or not. I mean, when you're doing it every single day and you're like really try to be consistent on it, it helps you know if you've forgotten. That's for sure.
There's nothing wrong with the mama box for your medicines. They put some jewels on it. It'll be fabulous. I keep
Bedazzle
the mama
it.
box in my purse.
Rhonda said she likes the peaches and cream. I think that one's a good flavor. Yes. She uses the weekly one. Um, so oh, she's a granny now. Um, questions for Aimee, guys. Aimee, do you want to do you want to tell them like a couple takeaway points? And then I'm going to jump on and show them some of the products they're talking about.
You know, I think we spend a lot of time after surgery talking about the vitamins and the protein and the fluid and all the things, right? If I could tell you one thing on the support group today that I would hope, and I saw there were a couple of pre-ops on here too, and I will tell you that this journey and everything that goes along with it is very, very at times can be taxing on your mental health. Do not ever, ever, ever be afraid to reach out and say, "Hey, this is a lot. This is a lot. I'm not in a good place." There's research that shows that the incidence of diagnosed depression goes up after bariatric surgery, and it's not that it causes depression, but I think that we might have to remember that our relationship with food prior to surgery has been extensively altered, right? If I am utilizing food to treat something that went on in my childhood, to treat some sort of emotion, and it's snatched away, there are some really, really powerful and uncomfortable emotions that arise from that. And so if you take anything from anything that I say as far as the medical stuff, yes, I could talk to you about that, but please understand that it is okay to not be okay, but it's also okay to reach out for help and say, I need someone on this journey. Your program should have some referral sources um, that they can get you to. That's my like constant takeaway. And if you're in Birmingham, you can email me. I can give you a phone number of a great um, psychiatry company that is a telehealth. I don't like to name drop because I don't want to seem like, but they are amazing. They're absolutely amazing. And if you're ever in Birmingham, Alabama, we do have a support group for my program that meets every month virtually and in person, and you can come hang out. I don't discriminate. You can always come hang out with us.
And Aimee has her email, Aimee Roth RN email.
Yes, yes.
And so guys, feel free to reach out directly to Aimee and she can share all that. I'm gonna actually I'm gonna type that into my notes, Aimee, because
Mhm.
I have a different email for you and I want to make sure I get that one
Yes.
down.
I don't love to use my work one because the firewall here is pretty intense, and they think everybody's trying to like give us those clicky links where they can steal your identity. Sure is not.
Yeah, work emails are definitely a little harder to get through sometimes. Well, Aimee, I'm going to jump on. Oh, we have one more comment. I'm struggling with cooking meals. I'm not hungry by the time I think about needing, so I grab a pack of almonds or a tuna packet.
That is what we call food fatigue. I call it food fatigue because it becomes like almost a full-time job, especially if you're early on after surgery, worrying about food. Like it's just constantly there. It's constantly you're just hyper obsessed about I have to eat. this lady told me I need to eat every X amount of hours, and they're telling me amount of ounces, and then they're telling me how much protein I need to get a day. And at the same time, we've removed a lot of that ghrelin hormone that takes away the physical hunger. And so it's very normal for someone to not feel that physical hunger from the ghrelin. And then they're like, it's just too much. It's too much. I don't want to go in there. I don't want to cook. It's just too much. And you grab convenience foods. Now, with that being said, almonds are probably not the worst thing we could do. They're a great source of unsaturated fat. Tuna packets, obviously, tuna is going to be a great source of unsaturated fat also. But if that food fatigue is getting you to that point where you're practicing avoidance, that is a great reason to reach out to your program's dietitian because they're really good with working on. I always say, how do we make this work for you, not you work for it, right? How do we make surgery work for you? So maybe you live by yourself. Maybe you don't want to cook. How do we make those convenience foods work for you? It's a great opportunity for your dietitian to cycle in on that.
Aimee, there's one other question that came in through
Mhm.
Facebook. It's from Pamela. She said, did the revision help you reach your goal? I'm trying to get to under 200.
So I will, yes. Obviously I'm on the GLP-1s now. My revision, I had some pretty intense issues with the band, and my anytime that you have a revision procedure, I'm very cautious about the way I phrase this. Anytime that you have a revisionary procedure, your rate of loss may not be the same as someone who had that procedure for the first time. You also may lose a little slower. Did it help me? Absolutely. Do I definitely I have to work for it every day? Also, yes, absolutely. So it helped me get to the point where I wasn't so miserable because at the point I was at, I vomited multiple times a day. Like not once, not twice, probably multiple. I'd say food would not go past the band. And when it did, I would base my intake around what I could get down. And so after I had the revision, I was able to eat, I guess you'd say, normally. I was able to enjoy the healthy foods that I wanted to enjoy, and it allowed me to continue on that journey. So that's my answer to that.
And I know to answer to Pamela's question, I feel like everybody's journey is so different. Like talking to
Mhm.
your provider, and I know that's kind of a generic stamp on answer, but
Mhm.
I feel like everybody's journeys are different. So depending on the reason behind maybe the stall or not getting to the weight that you want, there's many different reasons. And so like brainstorming that with a provider can be super helpful
Mhm.
because it could be anatomical, which means
Mhm.
something with the structure of your intestinal tract and your GI tract that's not really keeping you where you are, getting you where you want to go. But it also could be other things, a lot of the things that Aimee talked about. So maybe brainstorming that with a provider might be helpful to know if that's the kind of the route to go too. Um, Paula is asking about Berry Slim Advanced from
I
Amazon.
think I've seen them. I would say this: no, a good bariatric vitamin should carry at least 200% recommended daily value. A normal Walmart per se or regular vitamin that's meant like a Centrum, right? It has 100%. So no matter what brand you're using, make sure it is a reputable bariatric vitamin and always look at the back. I will tell you guys this. I'd never, if the front says contains iron, look at the back, make sure that it contains enough iron. Look at the back and compare the back of that bottle and the percentages of what it's giving you to what you need as a post-op. That's how you determine whether a vitamin is good or not.
Thanks for that advice, Aimee. And is it okay if I share my screen?
Yeah, let me undo mine. There we go.
Okay. I'm going to share my screen just for a second here, and I'm going to pop on to the ProCare website, which is just procarenow.com.
Mhm.
Again, procarenow.com. When you guys get there, I first want to share, if you haven't tried ProCare, we do offer free samples. So there's a little free sample button. ProCare is our sponsor today. They're the ones who brought me and Aimee together for her to share her messages. And so just want to give them a shout out for that. So they do offer free samples. Over here on the left-hand side is shop products. We do have a multitude of multivitamins, GLP-1 support, calcium, some therapeutics, protein. Under the calcium selection, I'm going to pop on that because we talked about the powdered calcium. I wanted to show you guys that.
Here they are.
Um, yeah, so they're like little single servings that you can mix in water or any kind of liquid, really, or foods. I would almost really just recommend foods over liquids because calcium citrate is one of those things you kind of have to keep stirring because the citrate doesn't dissolve as well as some other things. These are unflavored though, so there's not much of a taste. I actually have used them in my coffee before. I've used them in my yogurt, cottage cheese, things like that. And then the other thing that was mentioned are these calcium soft chews. Those are 500, both of these are 500 milligrams of calcium and 500 IU of vitamin D3. So got a little something. And our calcium soft chews are actually the only one that are all natural out there, and they do have added probiotics too. So just a little click on for that. Um, Also want to say there was somebody asking about our support groups as well. We do continue to have these guys on a monthly basis. If you're ever wondering where you can find our ongoing support, you just have to look under this resources button and very connected. And when you look there, the page looks like this. Aimee's event today will be on replay for at least a month. We put all of our events also on our YouTube channel. So following next week on Tuesday, you'll see her event listed on our YouTube channel. Right now, we have probably over 500 videos of replays on there. So if you are interested, you could actually go on there and type the search button and type in Aimee's name. And actually, you will see her other events that we've done together. She's done identity shock after weight loss, the mental side nobody warned you about, also navigating the ongoing changes in relationships and social dynamics. So she has done several other events with us. So go in there. Also subscribe to our YouTube channel where you get notifications. You'll see when her event is added from today on there as well. So big shout out to that. Join our Facebook group if you're interested in ongoing support as well. So actually have our next month's support group on there, which is with John. And he's just an interesting guy. I had to connect with him. I just knew he has lost 145 pounds and guys completed 40 marathons, 40 ultra marathons, 3 100-mile races, all since 2021 after losing his weight. So I don't do a lot of testimonials. I'm fortunate enough like to have people like Aimee, who is a professional, has also had weight loss surgery. So we've kind of had a mix. I'm always very excited to have people tell their own stories. So I'm going to stop sharing there. Just want to say thank you, everybody, for being here with us and watching and being a part of our community. And Aimee, thank you so much for taking time out of your
Thank
day. I know
you.
you're super
I love
busy with getting
I
ready for
love
your
hanging out with you guys.
vacation.
Yes, I am in survey purgatory right now. So this was a chance for me to crawl out from under my papers and coming out with you guys for a minute and get a little bit of support for myself because remember, we all need support. Please glean every bit of support you can get on this journey.
Yeah. Well, thank you. Thank you so much, everybody. And take care. Stay very connected. Bye, everybody.
Bye.